The Office of Interprofessional Scholarship, Service, and Education, or sometimes called OISSE, is in the School of Pharmacy and Health Professions. So we work with the departments of physical therapy and occupational therapy and pharmacy. But we also work across some of the health science schools, the School of Nursing and Dentistry, Medicine as well as with community partners and across the university in general. We're a kind of a collaborative group of faculty and staff who coordinate learning experiences out in the community settings. But they're health-related community engagements. We strongly believe that there are things best learned in the classroom. There are some things that are best learned in laboratories or clinics or hospitals, but there are some things best learned at an authentic community settings. And so the OISSE collaboration works to design and help facilitate those learning experiences for students. These are kind of unique opportunities because they link hand in glove with Creighton's mission and Ignatian values of men and women for and with others. While many of the health needs in communities are far greater than any one discipline, this provides a natural context for the different health professions to be able to learn together and learn to link arms to address health needs in communities. The unique part of this is students can learn kind of a cross-cutting skill set for health promotion and disease prevention, but they also learn as formation of their professional identities that this is a responsibility to society to actually link arms with other health professions to improve health of communities.
Our mission is really to share the resources and the gifts that we have. And we have such a tremendous wealth of student gifts and faculty gifts and resources that we can share. And I think there's a lot of need in our local community. And we are part of that community. So it's important for us that we engage with people in our community to help meet the needs there.
We usually recruit students to go to a variety of sites around Omaha. We also go to the reservations at Macy and Winnebago, and also internationally, Dominican Republic. With the local sites, it goes across the board in terms of age range. We'll work with children with disabilities. We'll work with inner city schools providing health presentations and activities. We've also conducted balance clinics that would be interprofessional in nature, bringing in occupational therapy, physical therapy, nursing, and pharmacy students. And actually, we get to then have them do care plans, provide recommendations back to those senior residents. And I think those are great experiences for students because they get to, classroom, goes out into the community. They get to apply what they've been learning in the classroom, enhance their clinical skills. They get to see other faculty kind of serving as role models, so they get to know the faculty a little bit better. So it is always, I think, a good experience for students.
I think that the experiences that I've had through OISSE in community engagement have allowed me to get a better idea and understanding about what some of the other health professions do. And I think in our training we are trained in little silos, and we kind of have blinders on because we're taught everything that you need to know about pharmacy or everything that you need to know about physical therapy. And it's really through these experiences where you get to interact with your future colleagues that you realize in the real life and out in practice you are all in collaboration together and you are all working together as a team.
I've done a bunch of community events with OISSE since my P1 year. I've volunteered at various community service events both in the Omaha and Lincoln areas. I've helped out with Holy Name School. We created learning modules related to different health-related topics for grades kindergarten through 8th grade. I've also helped out with educating and interacting with children with disabilities at the Ollie Webb Center. And so just a bunch of different activities that culminate together to make such an invaluable experience here at Creighton.
That was one of the things that I really loved about my experience at Creighton as a student, was how much we were involved in the community. It really gives you a good opportunity to practice what you're learning in the classroom and practically apply it. As a student, you might not be exposed to some of the real needs that we have in our community, and so it gives you a good opportunity to kind of become familiar with that and kind of how you're going to use that knowledge that you learn during the classroom to practice and apply to the people that you're actually working with. And it's been a neat transition for me as faculty then, because the Creighton faculty are really passionate about community service and using the community to provide an opportunity for their students to learn and to apply what they're learning in the classroom. It's neat for me as a faculty member to see students really opening their eyes and using what they learn in the classroom to engage with the people that are around them, provide a service, and really in turn take a lot from the people that they're engaging with.
I think it's really important to be involved in the community because it gives us the context of practice and what we're really dealing with people. And when you kind of consider the social model of healthcare, when we work in the clinic or the healthcare setting, it's very clinical. We have control over the environment, but the reality is people go back to their homes. So being in the community helps give perspective on what people are going through and what they're living with and how that affects their health. For example, people making healthy food choices, what are the barriers to that? We come with healthcare with a lot of knowledge, but maybe the patients don't. And I need to know those contexts to be able to be effective in my intervention. So being out in the community helps me have an understanding of that. And I'd also say that it teaches me what my patients need. So beyond just the clinical intervention, what's going on in their lives beyond that I need to be considering as a healthcare provider.
You see the need for flexibility, and you learn pretty quickly that real life is not as cut and dry, black and white as I think maybe we're taught. And so, like I said, having those experiences early on helped to give application to what you learn in the class. And it makes it easier, I found, for studying for tests or studying for classes, because you're able to put a face to that disease that you're studying or talking about. And you have that concrete experience to reflect back on, and that helps to make it more meaningful too, so that you have a personal connection.
The Creighton students have made a valuable impact on the foster grandparent and senior companion programs. They've provided training and education to our volunteers on health-related topics. They've done one-on-one vitals clinics with them and health fairs, things that will keep our senior volunteers healthy for a longer period of time.
Mantenida de Salud is a program that was designed by the Mexican government to provide preventive health education and facilitate the access to the community who are immigrating to the United States. Creighton students have demonstrated to be compassionate, culturally competent, and well prepared in order to serve our community.
It might sound cliche or cheesy to say, but they seem to care, and that's a huge deal. With Creighton University students, they don't come in with any sort of preconceived ideas on who our clients are or how they should help them out, but they just want to help people however those people think they need to be helped, and that's a big deal to us, to make sure that people really are treated the best possible way they can, and not just the way that us as the staff or us as volunteers think that they want to be treated. So the Creighton University students just seem to be extremely open-minded and passionate.
The opportunities that are facilitated through OISSE are somewhat unique because it's so aligned with Creighton's Jesuit mission of faith that does justice and men and women for and with others. And so the learning opportunities are available because it fits well with that mission. And so Creighton University students have resources and kind of an infrastructure here to help support those community-engaged learning experiences in a way that other institutions sometimes aren't able to have.